Hello, this is Dr. Jazayeri. Everybody knows me as Dr. Jazz. So I have sometimes I answer questions that people have asked us or I've read about. It's actually a very good question. The question is training versus experience. So should you go to someone who train at all the top schools, or should you go to somebody who is just an average guy, went to programs, here and there? It's a difficult question to answer to some degree because some of us are just more gifted. When I did my general surgery, the head of the program at that time was a colorectal surgeon, Dr. Haran and Karian. If you're listening, kudos to you. Thank you for all your help. I remember he had these giant hands, bigger than mine even. But when you watched him operate, it was just magical. I don't know how. Sometimes he made things so easy for us. We actually didn't want him to help so much because things were so easy with him. The same thing with my plastic surgery residency, Dr. John Robinson. Again, thank you for everything. If you're listening, he was just amazing to watch. So, like anything, there are tens of thousands of swimmers who are training at very good clubs and they train hard, but there's only one Michael Phelps. So, regardless of where they're trained, these people are just more gifted. The American Board of Plastic Surgery, so if you're board certified and a member of American Society of Plastic Surgeons, that means that you have gone to an accredited residency program. These programs are reviewed every few years, and if they have deficiencies, they're given warnings, and if they don't fix them, the program may shut down. So, all of us who have, gotten to this level have had, good training. But based on my own experience and looking at other people, I can confidently tell you that the best plastic surgery resident in the world that goes to what's considered the best plastic surgery residency in the world, when they come out, they may get some really good results here and there, but to get consistently good results, that takes experience. And even difficult cases, they're going to be struggling a lot. And that just, there is a thing with experience that, we need experience. Now, having said that, I'm very thankful for everybody who trusted me when I finished my residency. I mean, all of us have to start somewhere. So, and we all go through this. Some doctors just never improve. They just don't have that artistic sense. Most of us, if we pay attention, and I look at my before and afters and I compare to other people. So I think I've definitely improved, with time. But no plastic surgeon gets perfect result 100% of the time. I mean, if everybody tells you that, they're either haven't been in practice long enough or they're just not telling you the truth. We're dealing with flesh and blood and nature and healing and this and that. Sometimes we just do not get the result that we want. And sometimes I may not be very happy and the patient is happy, that's fine. But it's just impossible to get consistently 100% good results. I think the most important thing for you is to check the credentials of this doctor. Obviously, if they're just finished their training, they're not going to be board certified. The process takes about 2 to 3 years. So, that's not necessarily negative. But I think if a plastic surgeon has been in practice more than 3 or 4 years, so they've had plenty of time to get going and turn in their cases and this and that. So we have a written examination. We have to pass the written exam. Then we have an oral examination where you send them all your cases for, I think, a 2-year period or a 1-year period, and then they pick and choose 5 or 6 of them. Things may have changed a little bit. And they also have, I think, 6 questions from their own that they asked you. So you know, if there's a plastic surgeon who's been around more than 4 or 5 years and they're still not board certified, you know, the question is why. I mean, it is a pride thing. I think it's a good honor to have it. So you may want to ask them or do some more research. So make sure, you know, they're well trained. Hopefully they've passed the boards. If not, you know, again, they're just out. But you know, the most important thing is you have to feel comfortable with that surgeon and with the environment, with their office. And also, more importantly, well, that's important, but also their before and afters. You know, we all have certain styles. You know, I always tell patients who come in for breast aug or like Brazilian butt lift, I don't do exaggerated look. You know, if they want, you know, really big breasts or doesn't match their body or really big booties, I just can't do that. It's just not me. I want things to be natural. So they have to find a surgeon who does that, and there are plenty of people who do that. So you have to feel comfortable with that surgeon. Remember, it is a temporary marriage in a way. You're stuck with them and they're stuck with you for a while until you fortunately heal and move on. So you know, regardless of training, I mean, if you go to somebody who's trained at all the big names and they have a plaque on the wall that says best plastic surgeon in the world for 10 years in a row, if you don't feel comfortable with them, don't go to them. It doesn't matter what they say, you know what the this and that says or their work. You have to feel comfortable with them. It makes your life easier. It makes the surgeon's life a lot easier. So, you know, there's this big picture thing that you have to look at before you make a decision. So I hope I answered this question well. If there are any comments or did I miss anything, please comment below. If you have any more questions, we do have a lot of information on our website, a lot of before and afters, www.drjaz.com, drjaz.com. Thank you and be safe.